One of the common threads connecting all of our public health heroes is the ability to identify a need and then step up to meet it. Kim Amato is no exception. While working with Project Homeless Connect, Kim's heart went out to the struggling young families she saw, particularly those with infants. As a caring mother herself, she wondered where those down-on-their-luck parents could possibly come up with the many basic necessities newborns require. The answer, she discovered, was they faced very few options. So Kim set out to change that. As a marketing professional, she did her research and listened. She heard from nurses at local maternity wards, described the really heartbreaking stories they see every day, like that of the young father who took off his shirt to wrap his newborn child in because the couple had no blanket to take her home.
And that really broke my heart. And I thought, that's completely unacceptable. How can that be? How can that be? What's going to happen next? So I knew that there was definitely a lapse in services. And when I really started talking to other labor and delivery nurses and my connections within Salvation Army, Catholic Charities, Courtney Children's Foundation, all of those kinds of places, and I had established those relationships when I worked on Project Homeless Connect. So everybody was just a phone call away. What do you think? Should I do it? Is there a need? And everybody, I didn't even get the words out of my mouth. And people said, yes, please. I can think of 5 people right now who are going to give birth.
And so, about 2 years ago, Kim established Baby's Bounty, a nonprofit organization dedicated to providing infants from birth to about 9 months of age with the essential supplies they need to help start them off to unsafe and healthy lives. All parents receiving help from Baby's Bounty must be referred by a caseworker, and it's actually the caseworker who contacts Kim, defines the client's specific needs, picks up the supplies, and delivers them to the home.
Well, it's essential that we have the caseworkers involved because I am not a social worker. I need for them to screen the clients and make sure the need is genuine.
Funding for any nonprofit is always a challenge, and Baby's Bounty is no exception.
People were, generous, gave us some financial donations, but our biggest supporters have always been mothers who are finished with their baby items. So we talk to nursery schools and ask if we can have a little drive. We put a laundry basket in each nursery school classroom and ask for, gently used items, clothing, up to pack and plays and bassinets. I talk to mothers that I see in the supermarket and say, hi, you just had a baby. Have any more at home? No, I'm finished. Really? You're finished? Can I give you my card? Do you have any girlfriends? And we kind of laugh about it and have fun with it. But you can't be shy. The need is tremendous, and we're helping a couple of babies every day of the week, so we need a lot of stuff. So mothers who are finished with their infant materials can feel free to contact us, and we'll come get it or make an arrangement to meet you here. A lot of people, and this has just been fantastic, have held mock baby showers for us. So I had my kids a long time ago, but I'll get a few girlfriends and neighbors together and serve up some margaritas and everybody bring over a new diaper bag.
On a more serious note, in recent stories we've told you about the needless and tragic increase in infant deaths by suffocation because they didn't have their own safe place to sleep. Baby's Bounty makes sure each newborn has at least a pack and play to give them that safe sleep environment, and its Goodnight Sleep Tight program has received support from the Clark County Coroner's Office. While each case is unique, there are some basic supplies Kim tries to provide to each new mother.
It's new and gently used. I like to give them a new diaper bag at least, so they feel a little bit special. And the toys always have to be new. If there's a teething ring, of course, or a stuffed toy, it has to be new. We want the moms to feel like they're not getting, junk. If it's stained, we do our very best to try and clean it up as much as possible and, not give anything stained, never get anything torn. It really has to be something I would put my own child in.
And maybe that says it all. Kim's compassion makes each of these newborns her own. Her respect for these new mothers and the challenges they face is plainly evident. Her caring for the newest residents of Southern Nevada is helping to improve the community's overall well-being, and for this, Kim Amato is truly one of the Southern Nevada Health District's public health heroes. If you can donate items for infants from newborn to 9 months of age, or if you'd like to organize an event to help collect supplies for Baby's Bounty, call 485-2229 or go to their website, BABYSbounty.org. You'll find a wish list there of things they need for their clients, things they need for their operation, like someone to build storage shelves or the donation of a van, and ways you can volunteer your time.